Let's talk about TXA. So TXA was developed in Japan in the 1960s. It was originally developed to reduce maternal mortality from postpartum hemorrhage. Although it was developed for postpartum hemorrhage, it was initially used for dental procedures. In Japan, TXA is over-the-counter for severe menstrual bleeding. It was later used for postpartum hemorrhage. Nearly 50 years after being developed, the benefit in trauma was widely recognized and accepted by the military. In fact, it was accepted by Tactical Combat Casualty Care in 2011. And then in the early 2020s, it became the standard for civilian trauma care. So we'll look at some numbers. The CRASH 3 trial looked at the use for intracranial hemorrhage. And although not statistically significant, it did show promise. The CRASH 2 trial enrolled a huge number of patients, 20,211, at 247 hospitals in 40 countries. And the risk of death from bleeding was reduced by 10% when administered within 3 hours, with a 95% confidence index, which is a tremendous study with tremendous results. The risk of death was increased, however, if administered after 3 hours. There were several other important trials in tranexamic acid history that established its importance. These were earlier trials, and they were all retrospective. There was the MATTERS study, which enrolled 896 patients. The pre-hospital administration of tranexamic acid by ground forces in Afghanistan, the pre-hospital trauma registry experience, which only had 272 patients and was also a retrospective study. And then there was the military use of tranexamic acid in combat trauma. Does it matter? And that one was a little larger. It enrolled 3,773 patients, and it was also retrospective. So the way it works is it intercepts the clotting breakdown cascade. So it is an antifibrinolytic, and it prevents the breakdown of fibrin clots. It inhibits the conversion of plasminogen to plasmin. So TXA works right in here. So if you have a fibrin clot, and here are the fibrin degradation products, it stops that cascade. So when and how to give it? For our purposes, anytime you have any major internal or external hemorrhage except GI bleeds, it is not indicated for GI bleeding. This includes using it for intracranial hemorrhage. So when we talk about intracranial hemorrhage, how do we know? We talk about Cushing's triad, blown pupils, mental status changes, seizures, or posturing. How do we give it? 1 gram mixed in 100 milliliters, administered over 10 minutes. And we want to make sure we give it over the full 10 minutes because hypotension can result if we give it too quickly. So let's talk about what our protocol book actually says. So, tranexamic acid, injuries that might require blood products, torso or abdominal penetrating injuries, clinical evidence of severe blood loss. So that would be internal or external, and then major amputations. So upper extremity, lower extremity, Probably not a finger, a toe, something like that. Adults, 1 gram in 100 milliliters over 10 minutes. Pediatrics, 6 to 17 years old, 15 milligrams per kilogram in 100 milliliters over 10 minutes, max dose of 1 gram. And then postpartum hemorrhage, 1 gram in 100 mLs over 10 minutes. The time of onset must be less than 3 hours. That cannot be stressed enough. In postpartum hemorrhage, there cannot be evidence of retained placenta. So, contraindications: an injury greater than 3 hours old, disseminated intravascular coagulation, or GI bleed. You don't want to mix it with a blood transfusion or infusions of solutions containing penicillin. It's compatible with most common infusions, and it's not indicated for GI bleeds. So let's talk about disseminated intravascular coagulation. It is a paradoxical state, which is a hypercoagulable state with an absence of clotting. So the clotting factors are creating microclots, but you are bleeding out. So there is bleeding from multiple sites, oozing from around IV sites, nosebleeds, signs of internal hemorrhage, etc. Shortness of breath, chest pain, Houle mottled extremities, ecchymosis, things like that. And this is what DIC might look like on the skin. So you might have petechiae or purpura generalized over the body. If you have any questions, as always, feel free to come to me.